All right, I've come into the room. I've washed my hands, prepped. Hi, my name is Carrie. I'm going to be your nurse practitioner student today.
Hi.
I'm going to practice an HEENT exam. I'm going to start with checking out your head and scalp, if that's all right with you.
Sure.
Sure. We're just going to do the frontal, the parietal, occipital, and temporal. The skin is pink and moist. Any skin issues?
Nope.
Nope. Hair growth appears normal on the brows. Lashes, I'm just going to peek at your eyes and pull down. They're pink, they're moist. Don't notice any growths. Thank you. Any issues with your eyes, double vision?
Nope.
Flashing lights?
Nope.
Perfect. All right, I'm going to do some movements with my hand. I'm going to start. Can you follow my fingers up here? Follow them all the way down, back up. And we're just checking for extrinsic muscle activity. See if there's any weakness or nystagmus. And come back in the middle. Follow your eyes. We're going to do some conversions. Follow my fingers all the way in. About 5, 6 to 8 centimeters in. Perfect. Look at my nose. Pick something out there. We have accommodation. Back in at my nose. Back over that way. Back at my nose. Perfect. I'm going to shine a bright light in your eye.
Okay.
Is that okay?
That's fine.
All right. You can just stay looking at me, checking for a pupillary reaction. Pupils are about a size 3, reactive, symmetrical. And we're going to check both sides. And come over here, same thing. You can look at me. Right eye contracts appropriately. Same thing, contralaterally, correct response. Perfect. Next, we're going to do a quick visual. Actually, let's do the visual fields first. I'm just going to have you look at me. Tell me when you can see these fingers.
Yes.
Perfect. And these ones?
Yes.
At about the same time, so I don't feel like we need to test any further on the peripheral vision. Next, we will do the visual acuity, and then we'll go into the element. This one is a 6 feet, so we'll be 6 feet apart. I want you to cover one eye and tell me the smallest line that you can read.
EFTZD.
Okay. Can you read anything below? Negative?
Yeah, we'll call that
Okay.
a negative.
All right. Cover the 1 second to when you're ready.
We'll do EFTZD.
Perfect. Uncover that eye, please. Adjust. Go ahead when you're ready. We can do both eyes.
Let's do CFDHJ.
Perfect. With both eyes, that's a 20-20, which usually on a big chart you'd be 20 feet apart. Right eye is 20-30, left eye is 20-30. If you find it hard reading, you can go get an eye exam.
Okay.
Because you have no corrective lenses, right?
Correct.
I'm assuming since you're not wearing?
Correct.
Perfect. All right. This one I'm going to get awfully nice and close to you, okay?
Perfect.
So I'm going to start at 0, where you can go up to 10 to 15 on the magnifying side. I am going to have you pick a spot out behind me.
Okay.
I'm going to start. I'm going to place a hand on so that I don't bump you. I'm going to start a little 15-degree laterally. I'm going to try with my left eye. And I'm going to come in close, okay? Usually this is in a dark room. And then look directly at my light. Thank you, and away, back out. Perfect. I'm going to try the other side. Same thing, pick a spot out on the wall. You're going to feel my touch. I'm going to come in. We're gonna magnify bright light in your pupil. I apologize. We're at 10. Now look directly at the light, please. Alright, and away, please. On the exam, we're looking at the optic disc to make sure it's round, symmetrical. And you're also going to look at the fova. It's a little red dot behind. And make sure there's no AV nicking, which would be significant of hypertension. We check for copper wiring, which is yellowing of the veins. And also for white spots, which are indicative or oftentimes happen with diabetes. Or are occlused arteries. I don't notice any of those today on you.
Perfect.
You've got a red on the disc and a positive red reflex when you look directly at me. All right, ready for the next?
I'm ready.
Okay.
Let's go.
Any problems with that?
Nope.
All right, let's take a look at the nose and then we'll move to the ears if you're okay with that.
That's fine.
Any sinus issues?
Nope.
Any pain?
No.
All right. Again, you're gonna feel me touch and get in your personal space.
That's fine.
All right. Just looking for the middle and inferior tubernates, checking the septum. They're pink, they're moist, lined with some small hairs. No deviation or perforation or any ulcerations. Just gonna check the other side.
Sure.
Okay. Sorry.
No problem.
And tip your head back just a sec. Thank you. Alright. Again, turbinates look clear. Skin is pink and moist. No drainage. No perforation. No ulcerations. Any allergies? Seasonal?
Seasonal.
Any pain when I press?
No.
No. Any pain up here?
No.
No. No. Perfect. All right. Next, I'm going to take a look at your mouth.
Great.
Any trouble swallowing?
Nope.
Any cough or hoarseness?
Nope.
All right. This one looks a little funny. I apologize.
It's fine.
Lips are symmetrical. I'm just you relax your lips.
Okay.
I'm just gonna pull down. I would have gloves on. Gums are intact. They come together. They're pink. They're moist. Frenulum. I'm just gonna pull this one up. The tops look great. Also, open up for me. Stick your tongue out. Say, Perfect. Don't notice any drainage.
Yes.
Tonsils are non-present, which is good. You can relax, but open.
Sorry.
I'm just looking at your teeth. Teeth are in line. We're not missing. Doesn't appear to be any issues or cavities that I can tell at this time. They're all there. They're intact. It's positive. Bottom. Good. You bite together. Feel normal.
Yep.
Good. Open up. Move your tongue to the roof of your mouth. Good. Intact, pink, moist, and tongue to the bottom so I can look at the top of your mouth. Perfect. No white spots, no ulcerations or sores. Gag reflex intact.
Oops. Spooked me.
Perfect. All right. Next, we're going to take a look at your ears.
Perfect.
Any ringing with your ears?
No.
Good. Any pain?
Nope.
Nope. I'm just going to check around the outsides first, okay?
Okay.
Got earlobes, auricles, inside helix. Any pain behind on the mastoid?
No.
Perfect. Anything when I press?
Nope.
No? Okay. I'm going to take a look at the right ear first. You can go ahead and stay there. Just going to pull up and back and shine a bright light in there. We're looking for a pearly gray eardrum with a cone of light at 5 o'clock. There's no wax blocking. Looks great. All your bony prominences are intact and normal. I'm gonna go to the other side. Thank you. On the left. Alright, this side has a little bit of wax. Still able to tell. Conal lights at 7, pearly gray. Prominences are intact. And I don't see any drainage, redness, no bumps. Looks great.
Yes.
Spectacular.
Yes.
I'm gonna do a couple hearing tests.
Sure.
All right, this first one, I'm going to use a tuning fork. You can do the 216 or the 512? I'm gonna hit it and I'm gonna set it on top of your head, and I want you to tell me if you hear differently one side versus another side, or if it's the same.
Okay.
Okay?
Mm-hmm.
You hear the same on both sides?
Yes.
Okay. Perfect. Do you have any hearing issues?
No.
No. This one I'm going to hit it again. I'm going to put it on your mastoid bone.
Okay.
When you can't hear it anymore, tell me. Then we're going to listen like right in front, and then tell me when you can't hear it anymore. Okay?
Yep. No.
Okay. And tell me when it stopped. Still going?
Yes. No.
Okay. All right, we're going to do the same thing on the other side.
Okay.
Tell me when it stops.
No.
And tell me when it stops. This is just checking for bone conduction and air conduction.
No.
Perfect. The air will last, acoustic will last longer than the bone.
Okay.
So what I want, or at least tells me you don't have any of the inner ear, middle ear conduction issues.
Wonderful.
All right. I'm going to do a little whisper test behind you. You just repeat the phrases.
Okay. Yep.
1, 2, 3.
1, 2, 3.
4, 5, 6.
4, 5, 6.
Perfect. Any issues with hearing? Did it sound different on either side?
No. I think it sounded the same.
Perfect. Next, I'm gonna go ahead and start feeling around for lymph nodes.
Okay.
Have you ever noticed any trouble with your lymph nodes?
No.
Pain, palpable?
No, I don't think so.
No? Okay. I'm going to go ahead and feel me touch you.
Mm-hmm.
We've got some tonsillar, some mandibular, and submental. I'm going to have anterior cervical, just on the other side of trapezius. Any pain?
No.
I don't palpate any. And then we're going to do super on the other side. Perfect. I'm going to do posterior cervical. Any pain?
No.
No noted lymph nodes. No non-palpable. No tenderness. Perfect. I'm going to start feeling your trachea.
Okay.
I'm just going to have you tip your chin just up a tad. I'm just going to feel from trachea midline. Does that bother you at all?
No.
No? Okay. I'm just going to watch you take a drink of water and kind of tip your chin back.
Okay.
Just watching for movement of the trachea, making sure the thyroid, no goiters are present. Perfect. Go ahead and set your water down. I'm going to come from behind you, and you're going to feel my fingers palpate your neck.
Okay.
Again, I'm going to feel for the notch and go right down to palpate thyroid isthmus, off to the sides like a butterfly, All right, go ahead and grab your water and take another drink for me, please. Perfect. Symmetrical, no lumps, no pain. Perfect. Did you notice any issues with that?
Nope.
All right. Today looks well appeared. He's dressed appropriate, showered, clean. Eye contact was appropriate. Answers were appropriate, calm, cooperative. Can you remember what you did last summer? Can
Of course.
you tell me any good trips?
Sure. Oh, yes. Camping, Hampton Beach. Had a great time.
Perfect.
Went to Maine.
What'd you do yesterday?
Worked.
Anything good at work?
All kinds of good stuff at work.
Right.
Yep.
Mood-wise, any issues?
Always in a good mood.
Nope, you're in a good mood. All right. Is there anything else that you can ask me or tell me? Or anything that you have issues with?
No, I think everything's great.
All right. Patient seems oriented, ×4, GCS of 15. If you don't have any more issues, I think we're all done.
Awesome. Thank you so much.
Thanks. Have a great day.
All right, you too.